Hello, my name is Morel Santos, and I will be doing an evaluation of the Maternal, Infant, and Early Childhood Home Visiting Program, or MIECHV for short. So the problem I'm focusing on today are negative maternal and childhood health outcomes. And oftentimes, childhood health outcomes will be poor due to poor maternal or caregiver health in the first place. So, MIECHV is a home visiting program that aims to enter the home environment and provide solutions to this by building strong, trusting relationships with families who opt into the program. So, target audience, expectant or new parents and caregivers with children up to kindergarten age. And how do they do this? They do a needs assessment, so they identify and prioritize populations in the country, and then they'll select a specific home visiting service delivery model for that population. And really, home visitors will go into communities at risk for poor outcomes in the first place. The MIECHV is backed by government agencies. So the Health Resources and Services Administration works in collaboration with the Administration for Children and Families within the U.S. Department of Health and Human Services. So MIECHV uses publicly available data and research from the government at national, state, and local levels. This is the maternal and infant health mapping tool that I found. So it's a tool developed, again, government research. It uses data points like this, where the program can evaluate regions of the country that may need more resources and implementation. For example, in the screenshots, mothers in the southeast region of the U.S., so this is on the top, may need more home visiting services targeted at managing their hypertension in pregnancy or after pregnancy. So you see the dark green shades indicate the highest incidences of hypertension. So it's interesting to see how this data coincides with low birth weight data on the bottom picture. It shows the darkest red regions have the highest incidences of low birth weight. So one could infer that if we had home visiting services to help educate and manage hypertension in mothers, there may be lower rates of low birth weight. There are many interactive databases that demonstrate a strong need for home visiting programs. So there are 3 on here. The first one is maternal mortality, which is the death of a woman while pregnant or within 42 days of termination of pregnancy. So the CDC shows that rates have increased since 2018, and non-Hispanic Black populations are at the greatest risk. The second one is from Stanford Medicine on preventable childhood accidents. So these are a bunch of really sad statistics on this. And what do they all have in common? They're all easily preventable with right education and resources. So home visits can be a great screen for any potential dangers in the home. Lastly, the National Library of Medicine shows that depression affects 7.5 million adults who care for a child in the household. It's probably more because of lack of proper screening and a reluctance to report. So without proper intervention, this could lead to inadequacy in caregiving and emotional support for children. So the program reaches communities that are most at risk for poor health outcomes. So here are some statistical snapshots. These include families in poverty or less educated families, or families with a history of child abuse and mistreatment, substance abuse. In general, families that are ill-prepared due to situational circumstances. So any program, there are 20 of them that were eligible within the most recent fiscal year, must meet the home visiting evidence of effectiveness criteria. So this allows them to be eligible for funding. And each must meet the needs of the population. It must be evidence-based, and it must indicate some meaningful outcome in specific benchmarks. And they must be able to be implemented effectively in that community. So there are different variables that the program must conform or keep in mind. So environmental, the family home is very intimate and it's very sacred to many. So this allows being able to be invited into the home is very important because it allows the home visitor to observe any natural strengths and weaknesses within the family dynamic and help them in greater ways than they would be able to if they just saw them in the doctor's office or something. And each family has a unique set of cultural norms and traditions that the home visitor must be sensitive to. So this, being sensitive to this could lead to a great trusting relationship, and just, cultural relativism is key with home visiting. And legal factors involve ethical dilemmas. So it can get personal, but you must maintain professional boundaries. Economic variables. So, this is either supporting the family economic health or also just keeping in mind the program's own budget. And then organizational, the home visitor must be keen to different organizations that can aid as resources for the family to make referrals. So short-term goals and evaluations can be seen through these 4 performance outcome measures. So each one correlates to a statistic on the bottom. So understanding resources and skills that raise children. Understanding of these resources and skills can help raise children to be physically, socially, and emotionally healthy. So depression screening for the parents. These are real statistics showing the short-term outcomes. And then school readiness. So this was if, a family member read or sang to a child, postpartum care, and then well-child visits. And the program can continuously, or the program does continuously collect data for quality improvement. So each program must collect and report annually and quarterly, so to show the effectiveness of the program and for allocation of funds. And each one has to demonstrate an improvement in 4 out of 6 of the benchmarks that are outlined on the bottom there. And they're required to fill out several forms documenting their results. So those are the 6 very important benchmarks that show effectiveness. The long-term goals of the programs can be measured through data analysis of health indicators within each benchmark. So here are some examples within each benchmark. For example, crime or domestic or family economic self-sufficiency. So they would collect data on primary caregiver education. Did they go to school? Did they go back to school? Or continuous insurance coverage. So did the family have any insurance coverage? And for each outcome, we can measure long-term effectiveness by improved statistical values measured by bigger agencies like the CDC or NIH. So, after looking at all those specific benchmarks, we can look at long-term successes through statistics like, was there increased household family income that year? Or is there a decrease in use of government assistance programs in 5 years? So a closer look at MIECHV, I found a good quote on their website that says they want to turn good intentions into good parenting, breaking generations-long cycles of poverty, addiction, abuse, and despair. Again, they do this through regularly planned visits. And who does this in the first place? So nurses or social workers or early childhood educators or other trained professionals, and all of them, they have to work in partnership with the parent to develop plans. And this looks like empowering the parent and the family. So this they can help emphasize connections between the caregiver and the child, or give them information, give them support, give them guidance on different skills. They can help with employment opportunities, or just in general assess for any risks or strength and connect them to the proper resources. So again, here's a closer look at their goals. Here's an example of a home visiting program that nurses can be a part of. So this is a nurse family partnership program, and it impacts 40 different states. And its goals are to improve pregnancy outcomes through preventative health practices and just improve health development and self-sufficiency of the family. And here's some key statistics showing the impact that these specially trained nurses can have in the community. So program efficiency, specifically funding. So grants and agreements must be applied for by each program, and then once they're accepted, they have to fill out the home visiting budget assistance tool, and this is required every 3 years. So the MIECHV actually funds states, territories, and tribes to implement programs, and MIECHV itself is funded by the government. And effectiveness can be evaluated through publicly published databases, including this interactive map that I found, which is actually really cool to show the impact for each state and U.S. territories served. So for each state, we're going to answer the 3 questions. How is client satisfaction measured? Did the program meet its goals, or did the program provide a solution to the problem? So statistical analysis of each benchmark area. You can see on the right all of these statistics. So this one specifically for Tennessee, you can see how Tennessee compares to the rest of the country. And statistical analysis, and personal interview surveys with families involved are revealed answers to these questions. So for Tennessee, we evaluated Healthy Families America and Nurse Family Partnership and Parents as Teachers programs. So we can see that Tennessee is above average in early language and literacy activities and depression screenings. Really cool statistics. So the U.S. Government Office of Planning, Research, and Evaluation compiled a report called Impact on Family Outcomes of Evidence-Based Early Childhood Home Visiting, results from the Mother and Infant Home Visiting Program evaluation. And so they emphasize the importance of reaching children in the earliest critical years of development. And they found, they just compiled a bunch of statistics to show the effectiveness of MIECHV. So, is the initial problem solved? No. I mean, negative maternal and childhood health outcomes are going to exist as long as injustices in healthcare and society in general exist. So, like, things like generational poverty or just violence in the environment, just stuff that there so many factors, play into it, and it's just poor health outcomes are going to exist. But programs like MIECHV can provide some relief. And I know we want to compare. So how would we focus our care with the individual and population? So individual, we're caring for a single person, like a new mother or a new caregiver, one child, and we would do care through a focus assessment, an in-depth exam. But with population care, we're looking at whole communities at risk. So we're going to look at priority concerns for that community or policies and interventions that impact their health outcomes. So recommendations, there's always room for improvement. So further research could be done to evaluate progress. I would say that for short term, we could do more research into specializing programs for families with special needs caregivers or special needs children. And then long term, we could do like a study like ACEs to identify best interventions in the long run. And the program can continue as is as long as it's funded properly and the community is advertising it through health departments and hospitals. And it could really impact so many families and decrease even government spending in the long run, because families will be more motivated, be less reliant on government services, and just in general be more self-sufficient and just empowered to have a healthy family and life. And these are my references. Thank you so much for listening to me.